Hello there, I'm Dr. Michael Larimore. Today we are going to be introducing what a chiropractic adjustment is, why we do the adjustment, when is it indicated, and some of the details about that adjustment. Here at our office we tend to focus patient care on the spinal column and how the nerves relate to your entire body. Today I have Lynn here. She's going to be helping us out, and we're going to demonstrate what an adjustment is. First and foremost, a subluxation is a vertebra in your spinal column that can go out of position, alignment, and create interference with not only the nervous system, but muscles and ligaments as well. Primarily, we're hoping to get the nerves working to the highest potential that they can. All right, so causes of subluxations can include traumatic type injuries, prolonged postural type positions, for example, at a computer all day, things of that nature, creates tension and stress, and which can cause the vertebra to go out of place. It can be emotional or chemical stress as well. But today we're going to look at the adjustment as a way to correct those things. The adjustment is not a painful thing at all. It makes some noise. You get a release of gases, basically, and the synovial lining of the joint kind of pops in place, and so you hear this release. It's totally natural. It doesn't cause any pain, and it's just the noise that you have to get used to. So that's the biggest thing with the adjustment as far as what you'll feel. As far as some pressure, and as we go through and actually do the adjustment itself. So those are some of the different causes. We're going to start today by just laying you down and checking your spine to figure out where some of these subluxations might exist. And so let's go ahead and do that. So I'm going to have you go face down, if you don't mind. So when we do the adjustment, we usually have our patients start laying face down. And the reason for that is we usually do a leg equality check to see if a person's legs are equal or not. When they're not equal, it can indicate pelvic rotation or lower back type issues, or muscle imbalances as well in the lower part of the spine and pelvis. That's important because we are a closed kinetic chain, and if the foundation is off for any particular person, it can throw off their entire spine. So we start with Lynn laying face down, and we're going to do the leg check first. Okay, so we are doing the leg check for Lynn today. Her right leg compared to the left is a little bit shorter, approximately about a ½ inch today. And what that indicates is that she's got some pelvic rotation right through here, her right side being rocked down and back on that side. And so that leg check is important for that reason, so we get that foundation settled in. And then I'm going to do a little muscle testing today as well, and palpation to determine where her subluxations are. So a subluxation will show joint restriction as far as the joint will be locked up. It's going to show or cause some muscle tightness potentially, or even weakness, and it could be inflamed or edematous as well. And so for her today, her right side of her pelvis is rotated, and she also has an area here in the lower back that's also rotated. We're going to check the mid-back as well, and we'll go through and clear these out for her. There are different ways to be adjusted. There's the manual adjustment, which we are demonstrating in this particular video, but there's also a drop table, which is a table that has a mechanism that will drop to make the adjustment just a little bit easier, and that way there's no twisting or pressure such as that, which some people prefer. There's also instrument adjusting, where there's an instrument that we can use that has a smaller focal area to allow for the adjustment. So the option is individualized on what's comfortable for the patient and what the condition they have best requires. So we're going to adjust her mid-back here. All right, Lynn, so let's go ahead, we're going to adjust your mid-back. Let's go ahead and have you take a breath in and blow it out. And there we go, just let it loose. Good, very nice. So the adjustment doesn't take much force. Let's go ahead and lay you on your left side, Lynn. key to the adjustment, however, is just quickness is what it is. And that's where you get your best adjustment. So right now we're adjusting the lower back, okay, right there, and pelvis. There we go, nice job. Okay, I'll have you turn to the other side. And she's feeling and hearing that release. But as you can see, this isn't like all-star wrestling, so we're not throwing her around. And it's a very gentle adjustment. Nice, very good. Let's lay you on your back. So we just adjusted the lower back and the pelvis and the mid-back. So now we're going to check the neck region. So we're going to be adjusting the cervical spine, which is a person's neck. The biggest concern with the cervical adjustment for most people is they feel like it's dangerous as far as the risk of vascular compromise. One of the most recent studies out of Canada showed that 1 per 3 million people was the risk factor for having any complications. So it's very, very rare. And we do the proper testing to make sure that person can have that type of an adjustment. But today we're going to demonstrate the cervical adjustment manually. And so once we determine what vertebra is out of place and what areas being irritated, we're going to release that just like we did the other areas of her spine. All right, just relax, Lynn. We're going to come in. There you go. You're just going to let your head right over right there. And there we go. So it's a very small movement, but very quick. And the adjustment will move really easy. That do okay? Mm-hmm. You did great. So the adjustment itself only takes about 5 to 10 minutes. And as you can see, it's fairly non-traumatic. So contrary to what most people think, it's a situation where it's very easily done. So Lynn, how'd your adjustment feel today?
Felt good.
Good. So the adjustment's pretty easy. We always give information to patients regarding their specific condition, what they can expect, things of that nature. After an adjustment, Lynn, you can expect to be a little sore. It's like working out for the first time. You're going to be sore for a couple days because there's release of toxins, there's stretching of tissues that haven't been stretched in a long time. Your muscles are trying to readapt to a different tone, basically how tight they are. And so you're going to be a little sore, like you worked out, but that usually only happens after the first adjustment or two. Immediately you should feel, because there's a release of endorphins, so you should feel some relief already. And within the next 24 to 40 hours, probably even more relief as well. And so you're going to feel like, oh, you know, like just the pressure's been taken off, basically. So here's some information that will help kind of explain some of those things and what you can expect with your particular condition. And what we're going to do is just follow up and follow up next week and see how you're doing. We do more patient outcome-based recommendations at our clinic. So basically what that means is we want to see how you respond and customize your treatment plan based on that. Most people need 4 to 6 visits to get out of pain, and then it's a situation of stabilizing them and then getting them to do some preventative or wellness care every month or two, basically. But we're here for you to take you as whatever pace you want to go on that. So anyway, perfect.